everyone. Welcome to this webinar. We're just waiting a minute or two for folks to join, and then we'll get started. Thank you, everyone, for joining today. We are here for our webinar on pro bono financial planning for military personnel, veterans, and families, and we're going to get started here in just a minute. Thanks for joining us today. Just seeing people entering the Zoom. Thank you, everyone, for being here today. I'm going to get started. Welcome, everyone. My name is Rachel Roth. I'm Senior Director of Grants and Programs at the Foundation for Financial Planning. We're so pleased that you're here today for our webinar on pro bono financial planning for military personnel, veterans, and families. This webinar and the others in this series are eligible for CFP and AFC continuing education credit. We will submit the CE credit to the CFP board, and our AFCs in the audience will need to submit to AFCPE themselves. I'll let you know the code at the end of the webinar, and I'll also email it out after the webinar. Trying to switch the slide. So before I introduce our speaker today, Dick Power, I'd love to spend a few minutes sharing some information with you about the work that FFP does to expand access to pro bono financial planning for people in need or crisis. So we know that millions of Americans need but can't access ethical financial advice. More than half of Americans don't have savings to cover a $1,000 unexpected expense. And of course, there are groups that are especially at risk. People facing serious illness, victims of natural disaster, women, veterans, and members of the military. Our mission is to help people in need improve their financial lives by expanding access to pro bono financial guidance and advice. We've been around for about 28 years, and we've helped mobilize over 27,000 CFP professionals as volunteers. We've granted over $9 million to pro bono financial planning programs, and we've reached over 700,000 people in crisis or need with financial guidance. We do this in a number of ways. First, we develop and support pro bono financial planning programs in partnership with nonprofits around the country. We provide grant funding, technical assistance, and other resources to ensure that FFP-supported programs are effectively reaching those in need. Two, we recruit and train financial advisors to do pro bono service, and we connect them with pro bono opportunities through our volunteer platform, probonoplannermatch.org. And third, we lead the movement to foster pro bono service within the profession. We develop original research, industry partnerships, and public awareness activities. And I encourage all of you to check out our website and read our case for pro bono, which is some original research on how pro bono financial planning increases the likelihood that advisors will want to work at your companies, and also encourages folks to want to work there. FFP offers a number of other resources to support pro bono financial planning. Our volunteer training is a 50-minute online module that helps planners understand the basics of how to provide pro bono service. It's eligible for 1 hour of CE credit. We also offer a number of worksheets, webinars, user-friendly disclosures, such as our sample letter of engagement and more. Pro Bono Planner Match, which I mentioned, is the first of its kind platform connecting CFP professionals with nonprofits and lower income families. And we also offer E&O liability insurance, complimentary for advisors who connect with an opportunity through Pro Bono Planner Match or any of our grantees. This webinar is focused on helping military families and veterans I wanted to alert you to a new volunteer opportunity that we have with a platform called the Coordinated Assistance Network. CAN, or the Coordinated Assistance Network, is a secure cloud-based platform used to match military families to social services in partnership with hundreds of nonprofit organizations. Over the past year, FFP has been working with CAN to create a pro bono financial planning offering, and we're currently piloting it now with advisors to conduct virtual one-on-one sessions with pro bono clients. The portal provides a number of resources for volunteers and for pro bono clients, meeting calendar organizers, financial calculators, and more. And CAN and FFP support the volunteers. We make sure that volunteers are matched with pro bono clients, veterans, members of the military, and their families. And we provide a number of other training and resources to support you through the process. And you can sign up on probonoplannermatch.org, and I'll put the link to the opportunity in the chat. And if you can't participate in the Coordinated Assistance Network, we encourage you to get involved in other ways, check out our other opportunities, stay up to date on latest pro bono news, and support our mission. And with that, I'm excited to welcome our webinar presenter today, Dick Power. He's a sole practitioner of his own RAA power plans in Walpole, Massachusetts. He's been a CFP professional since 1993 after retiring as an Army colonel, where he served over 29 years of active duty. He served on the National Board of Directors of FPA. He's been a leader in military financial planning, assisting several chapters in organizing their programs to support troops and veterans. And he's helped organize the FPA national program to support the organization Homes for Our Troops. So we're so excited to have him here today to discuss how to work with military and veteran community. And we're so happy to have you here today. Everyone remember to put your questions in the Q&A, and we'll work through them at the end of the presentation. Thank you so much, and welcome, Dick.
Thank you very much, Rachel. I appreciate the opportunity to speak to everyone. I'm going to go ahead and open the presentation that I'm going to do here. And we'll get started. I love seeing so many people from so many places around the world joining us today, particularly a couple of folks joining us from Germany. I had 2 great tours there, and I love that. What I want to talk to you all about today is something first about some definitions about who military service members are. And you heard I'm a retired Army colonel. I may slip into the vernacular and just call them soldiers or troops. Please understand that when I do that, I consider soldier to be an honorific. So anyone that wears a uniform, Army, Navy, Air Force, Marine Corps, Coast Guard, they're all part of that group of people. They're the troops that we're talking about here. And so I want to identify who they are, what the composition of the force looks like today, perhaps define a few terms, talk about why we should be interested in doing pro bono work to support them, and then give you a rundown on what the unique military benefits are, because they're different from that in the civilian community, and some of the things that veterans have available to them, and then how financial planners can help these groups of people in unique ways based on our experiences. So first, some definitions. There's more than one kind of military service member. The folks listed first, active duty force, are the people we generally think of. These are the folks that are 24/7, 365 soldiers. They put on the uniform every day. They go to work in places around the world protecting our national interest. And we rely on them to do that. It's tough duty. It oftentimes is dangerous. It is stressful. It is demanding. It is unlike any civilian job you could define. And I've been there and I've done both. I can tell you with assuredness that that is a 100% true statement. in contrast to that is the traditional National Guard or reserve component member. And these are the folks that have regular everyday jobs like you and me. They may be plumbers, electricians, school teachers, police officers, accountants. They might even be financial planners. And they go to that regular job every day of the week, just like everyone else does, except on one weekend a month, they put on a uniform and they go and train with their military unit in the military specialty that they have been trained on by their service. They may be flying airplanes or driving tanks or doing all kinds of different things like that. One weekend a month, that's what they go and do. And then for a 2-week period in the summer, they go on annual training, off to some installation, an Army post, perhaps on board a ship, an air base, wherever they might be. And they really train with great rigor in their military skill base. They're unique people. There's another group called the Individual Ready Reserve. They don't go to the annual, the daily weekend training, rather once a month training, but they're called up once a year for 2 weeks, and they usually go to some sort of a staff job. A lot of them work in the Pentagon and places like that, and they go in and fill in and supplement the staff, because in times of great national emergency, many of those headquarters organizations need more staff, and they're prepared to go and do that. The traditional Guard and Reserve actually is organized into military units, so they have the equipment that that unit would have to have. They have the trucks, they have the ships, they have the tanks, they have the aircraft, and they need some full-time people to maintain them and maintain personnel and administrative records. So there's a category called active Guard and Reserve. And for example, an organization of 200 or 300 soldiers might have 2 or 3 people that work full-time to support them. And so when it's time to go to that weekend drill, the organization is ready to do that. This last point, active duty versus on-active duty, is a sort of a fine definition of terms. The active duty force is the ones we talked about first. These are folks that are always on active duty. And then reserve component people, when they're mobilized by the federal government, they are brought onto active duty. So they're on active duty for a time, perhaps a year, and then they return to their reserve component status, hence the minor difference. There's something about what the composition of the force looks like today. It's about 65%, 65 to 70% active duty, and the balance is reserve component, about 2.3 million people in total. And you can see that in the active duty force, the troops tend to be younger than in the reserve component. The reason for this is that the typical active duty service member joins right after high school, serves his 4-year commitment, and leaves. Whereas the reserve component member might join at the same time, but because they're living in the local community they were born and raised in and work in, they can raise a family, they can go through normal kind of life without a lot of disturbance, they tend to stay longer, hence they're older. Similarly, there's more women in the reserve components, again, because it's a less disruptive environment for living your life. Regular component active duty people can be sent anywhere in the country, anywhere in the world, wherever the service wants them to be, they go. And while it's a lot of fun in some cases, it also can be disruptive. The minority component's a little bit different in the active duty component, because a person who joins the military can be sent any place in the country. And so we recruit wherever we can find people to sign up. The reserve component, on the other hand, is a function of the local community. So whatever the demographics look like in that city or town, typically that's what the population in the military unit will look like as well. Both groups are about 50% married. There's no significant difference in which one have kids and which don't. An interesting observation is the numbers that have degrees. While the active duty force has many more officers, as you can see, a greater percentage, because they have to staff the big headquarters and the Pentagon and places like that, the reserve component actually has more people as a percentage with bachelor's degrees. And the reason for that is that people join, they stay in the local community, they may not move into the officer corps, and having a degree is required there, but they may be enlisted members, perhaps senior NCOs, and they will have degrees that are associated with their profession. Differentiating from those in the current service component is the veteran. And there's some formal definitions of veterans here. Basically, you have to have served on active duty for other than training, that is within a real military active unit for a period of time. And then you're qualified for veterans benefits as long as you are continuing to serve honorably, or you were discharged with an other than dishonorable discharge. There's several degrees of discharge. Basically, somebody gets a dishonorable discharge, has usually done some serious bad acting, and we don't grant them veterans benefits. My personal definition of veteran is anybody who has signed that blank check, because I got to tell you, any person who joins the military service signs a blank check payable to the United States of America for up to and including their life. Understand that. That is a commitment that almost no one else ever makes for anything. The veterans community looks a bit different, as you might guess. Most of it is former service members. There's over 18 million currently. 11% are female, because back in the day, we didn't have a whole lot of military members who were female. Today, there are many more, as we just saw, and that's growing over the next few years to about 18%. The minority population will move from 29% at present up to 42%, just because that's what the demographics of the nation is looking like. An interesting thing to examine is the sort of age, if you will, of the veterans, but I broke that down in terms of the war era composition, because it seems to me just a logical way to look at it. Almost all the World War II veterans, the greatest generation, they're gone. There are very few left, and very few Korean War veterans as well. Vietnam veterans, that's my era. I'm a veteran of Vietnam. There's still a goodly number of those around, and they represent about 30% of the veteran population. The Gulf War era, and that goes back to the early 1990s, represents the largest bunch, primarily because of the numbers that have been deployed, particularly in the last 20 years. An interesting thing to note is the level of disability, and this astonished me, frankly. Almost 1/3 of those 18 million have service-connected disabilities, and almost 2 million of them are between 70 and 100% disabled. Those are severe disabilities, folks. Usually loss of limb or something that's really debilitating. And so there's quite a number of those folks out there that need a lot of help. Why would you want to help these folks? Why would you do pro bono? Well, because frankly, being a soldier is tough. You could be sent anywhere, anytime, and your life is at risk. It's tough duty. You work long hours. You don't get huge amounts of money. You do get some benefits. You get a decent paycheck, but it's demanding, and your family and your personal life is disrupted. So there's a lot of factors that say, we all know, if we're professional financial advisors, that your financial posture is one of the most stressful things on an individual or a family. And these folks, if we can do anything to reduce the stress level that's natural as being part of a service member, we would be doing a great service to them. In the case of National Guard or Reserve component folks that are mobilized, called up by the federal government, and that's happened a lot in the last 20 some years and will continue to happen regularly, they face something different. They get a different wage structure. If you were a school teacher, you get paid one thing, and then when you go on active duty as a staff sergeant, you get paid something entirely different. You have a different set of benefits. If the primary breadwinner in the household is deployed, you got a different set of household expenses, because there's no one around to cook the meals or do the plumbing or whatever that primary service member usually did at home. So that's really important. Also, those folks that get mobilized have a new set of benefits that are quite different from the benefits they were used to in civilian life. And they're not necessarily used to them or accommodative, aware of what all the benefits are and how to use them best. If they come back, whether it's a reserve component or an active component member injured, there are a variety of support tools that are necessary to revamp their household situation, review their careers, look at educational opportunities, look at what comes after. They might be retired from the military because of their service-connected disability. And of course, some, fortunately not too many, but some have died. And if you ever work through that kind of situation with a client who lost a spouse, you know how difficult that is. It becomes more difficult when it's someone who's died in the service of their country. It's just a more difficult thing to cope with and deal with. Something about military pay. Now, military pay is different than pay for civilian jobs. It is straight down the line on one basis and one basis only. Every individual has a military pay grade. Enlisted people have a pay grade that starts with the letter E, E1 through E10. And officers' pay grades start with O, and they go from O1 to O10. So a brand new recruit just starting out boot camp is an E1. And rather quickly, they move forward to E2, at least when they finish boot camp, and they usually quickly go through to E3 and then start moving up the chain. Officers the same way. An O1 is a second lieutenant or an ensign in the Navy. And then they move up the chain as well. So that's the pay grade part or rank. The other one is longevity. How long have you been in the military? For example, an E4 who's been in 2 years will get one pay structure, and an E4 that's been in 4 years will get more pay. And it steps up automatically every couple of years based on the number of years you've been in service. The number of years you've been in the service, not the number of years you've been in that pay grade. So you might be an E7 with 20 years of service because you've been in the Army that long. And so your years of service are cumulative and your pay steps up accordingly. By the way, in this chart, you'll see a lot of underlined web links. They're all hot. So if you request a copy of the slides, this will connect you directly to the latest information. For example, the military members pay table will connect you with the 2023 pay rates, and you'd be able to easily find the 2024 pay rates from there. You'll notice that military members, not only do they get that pay structure, that's the base pay, they also get certain allowances for food, for housing, for clothing. Those allowances generally are not taxed. I'm going to go into this in a little bit more detail as we go forward. There is a special set of taxation rules for the military. And so the IRS every year does update their handbook for military pay. IRS Pub 3 has a link for that there. For those folks that are mobilized, the military pay may be more or less than their civilian pay. If you had a pretty good job and you were fairly senior in that job in civilian life, you probably got a pretty solid paycheck. There's a good chance when you go into the military, you're going to have a lower paycheck. The flip side is true if you're rather young and early in your professional life. You probably will also be early in your military life, but as you'll see in a moment, that doesn't mean you're poorly paid. So you might actually get a pay raise by going into the Army, particularly when you add some of the benefits in. So it's typical that senior officers and senior enlisted folks take a pay cut. Let's say you're a regular doctor earning a couple $100,000 a year. You might go into the Army be activated as a major, and you might make $125,000 a year or something like that. You're going to take a substantial pay cut. On the other hand, some young soldier might even be a college student. They'll be taken out of college for a year, but now they're getting a paycheck as opposed to paying somebody for doing something. So quite a different dynamic. Sometimes employers will make up the shortfall for activated service members. Some other things that you need to know about. Not only will you get base pay, but there's a thing called basic allowance for housing. The military provides housing for all of its members. If you're a single soldier, you live in a barracks. But if you're married, the service either will provide you a house to live in or an apartment to live in, or they'll give you money and you go get your own. If you're a National Guard or reservist, you have your own housing arrangement for your civilian life. You're not expected to give that up when you get activated for a year. So they actually will give even a single soldier an allowance for housing so they can keep their apartment or house that they had. If you're married, you get a family separation allowance if you're deployed, say, overseas to a combat zone. There is cost of living adjustments in some high cost areas, both overseas and in the United States. They're not too common, but there are some. And if you're deployed to a combat zone, then you'll get the various pays additionally that are listed here for being in danger, facing living hardships. And if you're crazy enough to jump out of a perfectly good airplane like I was, you'll get an extra $150 a month. But most of us do that for the fun and excitement of being a paratrooper, not for the extra $150 a month. That, by the way, has not changed since I was a lieutenant and got $150 a month. And that was a very long time ago. You'll also note that regular base pay that normally is taxable, when a service member is in a combat zone and their definition of where they are, that money is no longer subject to income tax. There's an exclusion process that they have for that. So that makes a big difference. Here's an example of what military pay might look like. So I've selected just randomly a specialist E4, pay grade E4 with over 4 years of service. Remember I said it's goes by time, so you might be an E4 with over 2 years of service. I just picked the ones that says over 4 years of service. That's a fairly common place for a permanent soldier to start off in the early part, fulfilling his first 4 years. And you'll see the base pay doesn't change whether you're married or single, but the basic allowance subsistence doesn't change. That's food. It's a food supplement. If you don't eat in the mess hall, you got a basic allowance for subsistence to feed yourself. But the housing does change. And you can see that the width dependent rate is considerably higher. I just picked Tampa as a general area. You got to pick someplace. And so usually it's based on your home record or where you were living at the time you were mobilized. And that's what you pay. For an active duty soldier, it's where you're stationed that determines what your housing allowance is going to be. If you're married, you get a family separation allowance if someone's mobilized and deployed to a combat zone, for example. And so I've picked the combat zone pay, so there's a hardship duty and a hostile fire pay thrown in there. But you can see that the pay rate for a single soldier who's, let's say, 4 years out of high school, under those circumstances, is $66,000. And because it's all going to be tax-free, it's the equivalent of almost $74,000 a year when you take into consideration the tax advantage. That's not bad for someone who's 22 years old. And so young folks like that actually aren't badly off. It's a little tougher with dependents. You don't get all that much more. We don't pay folks extra to have families in the military. That's a personal choice. We do try to help them maintain it by giving them a better housing allowance and assuring they get some of these other benefits. But it isn't that much more. It's about $10,000 more annually. That's okay if you just married or maybe have one kid. The problem is when you get a family who may be larger, they're faced with some financial dilemmas for the pay structure. And that's a place where we can help out, helping them manage those things. But even the younger soldiers need our help because their financial literacy, in my experience, tends to be quite low. Something about healthcare. Healthcare is one of the most expensive things that we all face. Whether we have healthcare through an employer or have to buy it personally, costs a lot of money. In the military, every service member is provided free healthcare by the military. We take care of our force to make them healthy and ready to go to war, ready to do their job. The military services have their own medics, they have their own doctors, they have their own clinics, they have their own hospitals. And if they had to send someone for specialty care to a private medical facility, the service would pay for the service member, not for the family. The family has health insurance through the military called TRICARE. It's a pretty good plan. There are different types of TRICARE, different levels of TRICARE, but by and large, it's much less expensive than civilian healthcare plans are, and usually can be provided pretty well. I think the cost of the what's called TRICARE Prime, which is sort of a preferred provider organization type of plan, usually pretty good. Costs about $1,000 a year for family, and it has modest copays, so it's really reasonably priced for that military family. Important thing to notice if you're working with someone who's being deployed is that full coverage from TRICARE for the family doesn't cut in until that service member has been on active duty for 31 days. So they should keep their civilian health care plan in place for at least 31 days. Otherwise, they might be uncovered in some way or other. And so it's good to remember to do that. Another thing to know about the reserve component is if they don't have good healthcare coverage through their employer, there is a plan called TRICARE Reserve Select, which, although a lot more costly than for an active duty family, is still quite reasonably priced as a healthcare alternative. And so oftentimes people that work for companies that don't provide much healthcare support will opt to join TRICARE Reserve Select. You can find more information at that link connecting to TRICARE. There is a retirement plan for the military. I'm sure you've all heard about that. The traditional plan, the base plan, works if you're on active duty for 20 years, you can retire at 50% of your base pay, essentially. So it's 2.5% per year of service. So if you're on active duty for more than 20 years, add a 2.5% for each additional year you're on. That's the plan that has existed for many years. They've just added to it, and I'll talk to you about that in a bit. For reserve component people, retirement benefits begin at age 60. And it can begin a little bit earlier if you've been deployed to a combat zone. I think for every year of being deployed or activated, you can start your defined benefit pension 90 days early. And so there's a calculation of doing that. And the benefit for reserve component people is a little bit different. They give you credit for each day that you spend on active duty, and then divide that by 360, and that's the number of pay years that you have in the service. So the calculation process is a little bit different. They have a system of gathering points because you can get extra points or extra days of service by taking a correspondence course or going to a special course or being activated for a special purpose or something like that. So there's a process there. There's also an annuity that goes with a military pension, or can. They have a thing called the Survivor's Benefit Plan, SPB, and basically they take the premiums out of your pension payment. And if you're a person that's on active duty, your beneficiaries would get that survivor's benefit if something happened to you. The benefit as a survivor is a lifetime benefit. So for example, my spouse is covered for 55% of my retired pay for the rest of her life. And of course, it's adjusted for inflation, just like retired pay is adjusted for inflation, just like Social Security, it tracks the COLA. The newest retirement plan is a blend of that old plan and a defined contribution plan. So we have the defined benefit plan that I described, but it's modified a bit. Instead of getting 2.5% a year for your years of service, you get 2% a year for your years of service. So for example, at the end of 20 years, you get 40% of your base pay. But in addition to that, the government has a 401k type plan called the thrift savings plan. And the new military pension plan, they put 1% of your base pay in that plan automatically. And the serviceman, and they automatically will default the service member into setting aside 5% of their pay. Now you can tell them to stop doing the 5% if you wish, but we strongly discourage that. After 2 years of service, and you're going to hang around for a while, the government matches up to the 5%. So they've defaulted you as saving 5% of your pay. And they're going to now have to, after 2 years, starting putting in the equivalent of what you saved, 5% of your pay. And so that's the maximum amount that they'll match. But that's not bad. So you're getting essentially 10% after the first 2 years of service, which is decent. And you can, of course, up your savings rate, and I'll talk about that in a minute. The reason we've changed the retirement system, it used to be that the only system was that defined benefit system, and you had to serve 20 years to get it. And the fact of the matter is 83% of the folks that joined the military did not stay long enough to get their retirement benefit. So they get nothing. At least in this system, by encouraging people to put money in the thrift savings plan, the thrift savings plan travels with them like any 401k would, and it transports, and that's good. A little bit more about the thrift savings plan. It's like a 401k. Similar limits in terms of how much you can set aside pre-tax. You can also use Roth. There are a choice of 5 basic investment funds. It's run by the government, but they contract out to a large agency, large companies to put together index funds for them. So you can imagine the size of the index fund, the cost basis is minimal. I mean, I think typically for, let's say, the large cap fund, we're talking 3 or 4 or 5 basis points a year. So it's a very, very low management fee. And there's no cost operating the fund to the member, none at all. So it really works out well. It's the cheapest, best choice that is out there. They have 2 fixed income funds, index funds. They have 3 equity index funds. And then they have 10 life cycle funds, which are your standard target date funds. And that's a pretty good choice for most of the members of the service. The higher paid ones, the ones that have been around longer, can benefit perhaps from some more customized approaches, but by and large, it's a good solution. Unfortunately, a lot of people don't participate. Perhaps they don't understand how it all works. Maybe they rely on that pension, but in any event, they just don't participate. I'll just mention the last one, the savings deposit plan. You can actually set aside $10,000 when you're in a combat zone, and the federal government will give you a 10% interest. It's been around forever. I used that when I was in Vietnam. I hate to tell you how many years ago that was. So it's a long-standing plan. They also have insurance, servicemen's groups life insurance, up to a $500,000 benefit. And you can transition that to after you've completed your service to a veteran's benefit. You can cover some dependents as well. There's obviously no exclusion, no work laws. People sometimes worry about that. In life insurance, this is the one that you don't have to worry about since the government is doing it for military members. There's a link down there that will give you a little more detail about that if you're so inclined. They also have traumatic injury insurance, another $100,000 on top of the basic servicemen's group life insurance. If you're injured while you're in the service, either peacetime or wartime, doesn't make any difference, you'll get your full pay and benefits during the period of incapacitation until such time as you're discharged from the service. So you might be determined that you're no longer fit to serve, and you'd be separated. And you might be medically retired, depending upon the nature of the injury and the link, how it was occurred, and the length of your service. People get paid based on their pay grade and their injury and the level of injury. The military service retires people and identifies a certain level of disability. The Veterans Administration has their own system, and they look at the specific things and create a different number perhaps, and that determines how much disability pay one would receive. I'll hit that in the next slide or so. But their disability compensation is tax-free. The federal government also has a long-term care insurance program, which is decent. I've looked at it in comparison to commercial long-term care insurance plans. It's not as many options, it's not quite as flexible, but it's good enough for most people. And it's reasonably priced relative to private plans. If someone dies on active duty, there's a tax-free death gratuity. They get their SGLI insurance plan. Assuming they're fully covered. There's dependent and indemnity compensation through the Veterans Administration for the spouse and dependent children. And the amount of compensation depends on what the structure of the family is. If the person that is deceased was eligible, the dependent or spouse would get survivor's benefit plan. And they get some additional services. And any service member that dies typically has a casualty assistance officer assigned to the family to help them negotiate the forms and making the elections that are necessary. Military service bases also have fraternities, and service members and veterans can get free legal service through those military installations. Usually they do basic estate planning. I'm talking about wills, powers of attorney, healthcare proxies. They won't do fancy estate planning documents or anything like that, but they will take care of the basics. And so that's the first stop that anybody should make. They should make sure they're covered. Now, most military people, they insist on them having wills and powers of attorney before they deploy. For the veterans benefits, all I can say is there are a lot of them. It's really complicated. I can't tell you exactly how any of it works because it's just too complex. There isn't any one answer. The Veterans Administration is a huge organization, and there's 18 million veterans out there, so they're working with a lot of people. Check with va.gov. I can tell you, however, we talked about disability pay, and as an example, someone who's 50% disabled and has a spouse only, no kids, would receive $1,179 a month, tax-free. If they are 100% disabled, it would be $3,750 a month. And 100% disability in the VA isn't the same as Social Security. So there are people that have 100% VA disability that do not get SSDI. It depends on the nature of the disability and how severe it is. But anyone that's getting 70 to 100% disability has had some definitely difficult circumstance to deal with. One of the benefits that military service members get is a GI Bill post 9/11. Essentially, it's full tuition and fees at a public college. They get a housing allowance based on a listed pay grade 5 in that area of the college, and they get an allowance for books. So a lot of GIs, when they get out of the service, opt to go on to college and get their career really kickstarted. The GI Bill for housing is legendary. It's been around for a long time. Essentially, you can buy a house for you can get a mortgage for up to 100% of the appraised value of the home. There are limits placed on it, but essentially you don't have to come up with a down payment because the Veterans Administration underwrites the risk to the mortgage lender. And so that works out really well. That's a very important benefit. It's a huge healthcare system. The Veterans Administration runs the largest healthcare system in the country. 154 hospital centers, 800 clinics, so you don't have to go all the way to the hospital, and other services as well. Getting service is based on your priority. Somebody that's wounded in combat, has a disability, they're going to go to the top of the list. Somebody who wasn't wounded and gets a pretty good paycheck now is at the bottom of the list, and they'll have to pay something if they can get service at all. Some states have their own benefits. Every state has a veterans services organization of some sort. Very often they're at state level. Sometimes they have regional offices. In Massachusetts, by law, every town, every city has to have a veterans service officer. Benefits are controlled, if there are any, in the state by state law. And it would vary from state to state, so you just have to look into that. I would say that the best place to go to understand veterans benefits are those veterans services organizations at the state or town level, if you have one. And very importantly, veterans services organizations like the Veterans of Foreign Wars, Disabled American Veterans, American Legion, they have specialists who help people navigate the network of benefits available and help you apply for them and work those applications through the system. So it's very important to seek that out. If you're advising a veteran, you should know about that. Some of the things that we can do to help these veterans are help them get their stuff in order, regular kind of things that we would do with any client, emergency fund, powers of attorney, figuring out who's going to do what to whom, having a budget, taking advantage of some of the benefits that they have to plan for the long term. If they're particularly a mobilized soldier that is a business owner, and there's lots of them, most of us are business owners or work in small businesses. We know what it takes to run those small businesses. We can help them make that transition. The Small Business Administration does have some resources available as well. I mentioned the tax guide before. You can click on that link and get this year's tax rules for the IRS. States generally follow the same rules, but I would check with state tax authorities to be sure about that. For particularly people that are mobilized from the reserve component, there's some advantages in terms of protection on interest rates for old debt that they had, civil prosecutions, health insurance. They don't get messed up in their financial space because they were mobilized. Also, if you worked in a civilian job and you got mobilized because you were in a reserve component, you get your job back when you come home by law. And there's a lot of other nuances about that, but it's very important. It becomes a contentious issue in some cases and needs some assistance, and the employer support for the Guard and Reserve is very helpful in helping individual soldiers return and get back into their lifestyle. And of course, there's some continuing healthcare benefits that are available to soldiers that return from a deployment and leave the service, but they still get continued care. And if someone loses a service member of their family, we can help them apply the death gratuities in the wisest way. I haven't got time to tell you all the war stories, but I could tell you a few about that because I've done it. Make sure they get in the right application in for dependent indemnity, compensation, appropriate healthcare coverage, and so forth. Important documents are the leave and earning statement. That's a military paycheck, pay stub. And so you want to understand all the pieces and parts about that. They need to be enrolled in DEERS, Defense and Eligibility Reporting System. That essentially gets them into the TRICARE system, which is really important. The most important documents for a reserve component person who's activated is the mobilization and demobilization order, because that sets the exact dates and makes it official. In conclusion, I'll just say military families are different. They're not all that different, but they're different. they face a different set of stresses, a different lifestyle, a different set of pressures than ordinary folks do. And we ought to help them because after all, they're out there serving us and keeping us safe. And not many people in the country step up to doing that. We can help them and put a little time in to serving them. There are specific financial pieces in the puzzle where we can help negotiate that now that we know some of the benefits, and you can do the research to pick up more information if you want. I will also say that there are some folks that have unique conditions. They come back that they're severely injured. They may have mental trauma. We've all heard about PTSD, combination of that and depression and other stress, financial problems, perhaps injury. That requires some special kind of skills to attend to them. And we'll be talking about a lot of that in our next session a month from now. We're going to have a panel that will address some of those unique concerns that are quite special that we can help with. That concludes my remarks. I got a few minutes to answer some questions. If anyone has any, I will stop my screen sharing here.
Thank you so much, Dick. I'm just going to run through a few of these questions and we'll try to get through as many as we can. So if you have questions, please put them in the Q&A on the bottom of your screen. Even if you put a question in the chat, please put it in the Q&A so we can have them all in one place. The first question is, are there opportunities for retirees 60 plus years old to join the individual ready reserve?
Usually that's something you do immediately upon leaving the service. Usually not as a retiree. When you've retired, you're retired. And so it'd change your retirement posture if you joined the individual ready reserve because you'd still be active, essentially actively in the reserves. So I don't think someone who's drawing a pension can also be in the reserves at the same time.
Thank you. Is there a good calculator to determine whether a couple should select SBP or not?
I know of no calculator because choosing it depends on how important your military or retired pay is in your retired income stream. So for example, for a lot of reservists, it doesn't play that big a role. And so the survivor's benefit plan isn't necessarily that important. But if you're like me, and most of your retired income comes from your Army retired pay, yeah, you want to use that survivor benefit plan for your spouse. So I think it's very much a personal choice based on the family's condition.
Is the first 1% into the TSP for the blended system deducted from the member's pay, or is it in addition to the base pay?
1% is contributed by the government. The 5% is deducted from the member's pay, and they can opt out from that.
Great. And can you elaborate on what VSI is?
On which, I'm sorry?
VSI.
VSI. Veteran Survivors Insurance. I guess that's what we're talking about. That it's like.
Yeah, if the person, this is from an anonymous attendee, if you can specify, please do.
Because I don't think I used that acronym. But what happens is you have SGLI, which is Service Members Group Life Insurance, and then you can use veterans. You can transition that over to veterans life insurance. It's a similar program. The cost is a little bit different, but it's very similar in nature. But you got to do that within a short time of your leaving the service.
Oh, voluntary separation incentive.
I'm sorry, I do not know anything about that.
What advice do you have for planners who work with a veteran who qualifies for disability pay, but does not want to apply for it or take the money?
That's an interesting thing. The advice I would give them is this: apply for it, if nothing else, because if you have disability pay, it may qualify for your surviving family members, if you predecease them, to get dependent indemnity compensation. And if you haven't applied for it and qualified for it, they won't get the benefits. So put in your application, even if you don't need the money. It's there, and it's there for you and your family.
Thank you.
I'm in the process of doing it. I certainly don't need it, but I want my spouse to have it available.
Many years ago, I worked with returning Guard and Reserve members activated for the Gulf Wars through an organization called MHN. Is that organization still around? Have you heard of that organization, Dick?
That was the Military Healthcare Network, and they provided financial advice on post to soldiers. And I think that was a contract arrangement that the Department of Defense had with MHN. And there's a different agency now that does that, because the military still does provide financial advisors on an installation. And I'm trying to think of the name of the organization that does that today. It escapes me, and I do know it. I know some people there. For some reason, I can't bring it out of my brain lobe. But it's just a different company, and a lot of the people that were planners for MHN just shifted over to them.
Someone mentioned it might be Ziders.
Ah, that's it. Ziders, yeah.
Thank you, Trisha. Do dependents have access to unused college tuition benefits?
One can transfer earned college tuition benefits to your kids or your dependents. It's a choice that the service member makes. When they've earned the benefit, they can transfer it over. They make a designation of that. So if they don't need the benefit themselves, they can transfer it to dependents.
And can the GI Bill be used by dependents or just by military service members?
Well, it's the GI. It depends on what part of the GI Bill. For example, if you're a dependent, a surviving spouse could use the housing benefit, for example. I don't think that the education benefit transmits unless the military member designated a portion of it to go to their kids. I worked with one surviving spouse whose husband did pass the benefit on to his kids because he had no intention of going to college. He didn't go any further. And so he immediately signed up for the benefit and transferred to his kids, and his oldest son basically had his college costs covered.
Got it. Regarding TSP, I've heard that there's some controversy over the self-directed portion. Not sure if that's what it's officially called, but it allows you to buy any mutual fund. Can you comment on that?
Yeah, that's a new introduction only in the last couple of years, where they allow you to go in and buy anything you want. I guess some people pushed for that. Maybe some financial advisors push for it so we'd have clients. My personal view of that is that I wouldn't recommend it for most people in the military. You can do well enough with the index funds that are available. And I think most of us know, frankly, that index funds over the long haul perform better than actively managed funds. And that's been demonstrated time after time after time after time. And so I'm not sure why you would try to come up with some other approach to do that. It's going to cost more money. It's not going to necessarily give you any better performance. And so I'm not sure what the benefit would be. But if someone thinks they're an investment guru who wants to do it, I suppose they can. I wouldn't encourage it.
Thank you. So we're at time. I'm just going to do a few housekeeping things. The code for AFCs that you report to AFCPE is FFP09, and my colleague Jordan is going to put that in the chat. We'll also send it in an email after this webinar. In the email after the webinar, you will also receive this deck. And we will also be sending another follow-up with the deck and information about our opportunity with the Coordinated Assistance Network. as well as information about part 2 of this webinar, where Dick is gonna speak with Dr. Brandy Baxter, who's an AFC and a financial fitness coach. And it's gonna be directed more on some of the social, medical, and mental challenges that military families often face, service-connected disabilities, caregiver challenges, and some of the other special circumstances that Dick mentioned later in his presentation. And that webinar is going to be on February 21st at 1 p.m. Eastern time. So we hope you all can make it. We'll make sure that we send out information. And Dick, thank you so much. This was so informative. This is a great resource for all of our pro bono volunteers and coaches and nonprofit leaders. So we really appreciate you being here.
My pleasure. See you all sometime.
Thank you.